Joining us now is Seth Denson, the president of GDP Advisors and a market analyst and strategist who's covered the healthcare industry very extensively. Seth, thank you very much for joining us tonight. Healthcare has been probably the biggest, I would say, topic so far throughout the election cycle for Democrats. It's still to be seen if that's going to be the same type of instance when we get to the general election. So I just want to start kind of asking very broadly, what is the state right now of the U.S. healthcare system?
Well, listen, I think from just an overall innovation perspective, the U.S. healthcare system is in a very good place. We are responsible for the vast majority of innovation utilized throughout the world, which is why it's very important that we sustain the free market system that we have today and not dismantle it. That being said, I would agree with you in that this is going to remain top of mind in large part because while I think that the Trump administration is taking the right steps when it comes to health care, actually driving down the cost, they've also not done a great job of owning the narrative, and Democrats have, and they won in there in the last election on it.
No, and I think you're right. The Trump administration has done stuff such as trying to lower the prices of prescription drugs, right to try, stuff like that. And I think they've been actually pretty effective on that front. And it's something that even Senate Majority Leader Mitch McConnell says that they might be able to make some progress on with Democrats. It's one of the maybe few issues where that could actually be something that we see come to fruition. But for the time being, say we were to put politics to the side and acknowledge the fact that there are great innovations being made when it comes to, as you were saying, in the healthcare industry. What else needs to be fixed within the healthcare industry? Because clearly there's something wrong with it that a lot of people, at least on the left, see problematic.
Yeah, I think the key thing here is to understand that there's a difference between health insurance and health care. That's where all conversations need to start. And a lot of times we think about health insurance and health care as the same. And where I'm going with that is in a free market system like we have here in the United States, the consumer in the end is the manager and the driver of the system. But when it comes to healthcare, the system is very opaque. It's not transparent. Consumers don't know what issues or what costs there are in the system until long after they've had them done because we focus on insurance. And insurance is just the credit card. So we need to bring more transparency. The Trump administration is working on this. Secretary Azar is pushing for this. This is a positive step so that the consumer can have information before going out there. At the end of the day, the consumer will drive the market where it needs to go.
And that's the whole premise, right, is that they want to kind of take out the government's role in it because that's the invisible hand, if you will, that kind of drives the market. They want to be able to kind of create competitive prices so that private insurers then have to be competitive with that as well. But then meanwhile, you hear the Republicans or conservatives, I should say, kind of make the argument that that's not the job of the government. That is the job of free markets, private government, stuff like that. And they point to other things where necessarily the government hasn't been able to be successful on that front. So then when you hear some of the 2020 presidential candidates, we often hear them about talking about getting rid of private health care insurance altogether. Would that help in making any of the goals that you are talking about right now as far as improving the healthcare system?
No, because it's focusing on the wrong thing. Listen, 90% of all of the drivers of cost in the healthcare system are generated by 6% of the population. Wow. So eliminating the current healthcare system as it sits today in the insurance system effectively kind of dismantles a system that's working for 94% of our population. So let's focus on the drivers of healthcare cost, bring those down, and then everybody wins. That's the way free market works. It allows us to continue to innovate, be competitive, allows new companies to come to the forefront that want to be competitive, and allows the consumer to drive the market.
So what should the conservative messaging be on this front then? Because we hear the Democrats making a very, I would say, persuasive to some degree argument because you hear that it's actually affecting a lot of Democratic voters in the primaries and the polls right now. It's a very appealing thing to hear that your Medicare will be totally covered for. You don't have to worry about it. Of course, once you get into the weeds a little bit, that's when people start having their doubts, especially when it comes to the costs. What should the conservative messaging be when it comes to this issue?
Yeah, understand that everybody's fine with free healthcare until they realize that free means restricted because somebody has to pay for it. And when right now, the American consumer has the ability to make a decision for themselves what doctor they want to see, where they want to go. They don't like an answer, they can go somewhere else. In a government-run system, sorry, you're getting what you get. Free market's off the table. You're going to take it, and there is nothing other than leaving it.
Yeah, well, I hope there's some Republicans watching right now that make the decisions of how they're going to market this going into 2020, because you probably just laid out the best conservative plan that I've heard so far. I mean, it's something that really a lot of Republicans haven't really brought to the forefront right now, and I think it's going to be a very big issue going into 2020 because we see how effective it is right now in the Democratic primary. Clearly, there's something there that the voters want answered. But Seth Denson, thank you very much for joining us tonight.